Postpone procedures can be any procedure, can be operation, can be arthroscope. طبعا the patient is angry patient. So this is the script. You can see it. So you see
Yeah.
the screen. So 45 years old woman, obese, working in supermarket, and had a tear in one of the right cruciate ligament of the right leg. She took many painkillers that cause gastritis. She had appointed today to have arthroscope. Mr. Arthur is called for an urgent compound fracture with vascular injury. كاتب لك what he called for. You are Dr. Richard, orthopedic surgeon, SHO. Mr. Man, the consultant asked you to explain the matter to the lady.
Mhm.
Okay? You can start.
Okay. Hello. My name
Hello.
Dr. Osama. Yes, my name Dr. Osama. I'm surgical hospital here. I'm calling to I'm calling from Mr. Man to contact with you and inform you some information.
Okay, so
And
where is Mr. Man? He's supposed to do orthoscope to me today. Is why he's not coming?
yes, I'm sorry because the Mr. Man is go away from the hospital because have calling away an emergency cases due to injury for the urgent operation.
So
That's
this
why
is important patient. I am also have a problem.
yes, yes, I know that, but I as inform you, it's the urgent cases maybe affected of the life of the patient. That's why it's go away now.
Okay, no, it is not affect his life. This is urgent operation. It is in the hospital, but this patient have fracture. You know, fracture can postpone, but he have a fracture with vascular injury.
Vascular injury.
So you know that we need to have a vascular repair and the
Yeah,
bone fixation because if more than 6 hours, the patient can have ischemia or we can have amputation on his leg. So you
yeah,
need to explain to the patient this is serious condition because they have a vascular injury. Although your consultant is orthopedic, but he need to be vascular and orthopedic together. Okay. So, all right. Okay. So, but I have right arthroscope today, and I take the like leave or unpaid leave for my job.
Yes, I will write you another the sick leave to take it and your manager and inform your manager about why it's postponed your operation and inform him about that.
All right. Okay. So, what else you need to tell the patient?
Yeah.
So
Mhm.
you call me again, or what happened?
Yes, I will contact with you and put you in the list and give you the priority, and I will inform the Mr. Man about that. And I
Okay, so usually the contact is by secretary. So the secretary will
yes,
contact you, and of course, we confirm with the Mr. Ben that we have first priority, and we
yeah,
send the letter to your job. Okay.
yeah,
So, is any advice for me because this is have severe pain? So, any advice for me?
yes. I'm sorry to hear that about you, but I will prescribe you another painkiller to relieve the pain, and I will inform you do some exercise, and I will refer you to the physiotherapy
Okay,
to
so
do some exercise.
exercise, okay, sport, okay, swimming, okay, physiotherapy is okay. Advice here to
Bear weight
reduce
and
weight, okay.
yeah.
But as you see here, this patient he have many painkiller and cause gastritis.
Yes, please, can I ask you what's the type of the painkiller you can take now?
I take non-steroid anti-inflammatory. Because
Okay,
I
I
tell
will.
you why. Because the patient in the last exam, when the students still here, I give you another painkiller, so it is better than the before. He tell him, so why you don't give me the best painkiller from beginning?
Uh, yeah,
If it is
I
have
will.
good
Mhm.
painkiller, all are the same. All non-steroid anti-inflammatory is the same, can cause gastritis. So is
Yeah,
already patient have gastritis, so it's not wise to give her any painkiller because all are the same. So we don't
Mhm.
have another painkiller. Maybe you can give local ointment or something can, but you don't give her any tablet. So if the patient asks you, this is a question, can you prescribe to me painkiller, more painkiller? No, as you increase the risk of stomach ulcer or peptic ulcer.
Yes, I will
Bec-
prescribe you some gel do in your knee that lead to relief to the pain like local painkiller.
okay, so it is important because all
Yeah.
painkiller, non-steroidal anti-inflammatory is the same. Maybe some coated, some not coated, but the idea is I don't give you another one and the safe one. But if it is have another one, so you must give it from the start.
Yeah.
Okay. So it
Mm-hmm.
is easy station is very common and come maybe last time usually this have station easy just to don't take a time.
دكتور هي
Yes.
الستيشن دي كانت فيها شوية أسئلة إضافية،
Like
فكان
what?
البيشنت عمال بيزعق ويعيط وأنا حامل إيه في رجلي. ففي واحد من الطلبة فقال له أنا حاعمل عايزني أعمل إيه، أنا حخسر وظيفتي. فقالوا له أنا حاعمل لك sick leave وcontact with your manager and inform what's your postponed 2 times. فقال أنا زوجتي متضايقة مني وكيف بنفهم زوجتي my wife he's waiting me outside what I will inform. فهو كان عايز
You can ask him to bring his wife and speak to her.
yes.
Okay. All
And
right.
ask about what's the I need to give me some information about the operation and what's the type of the operation.
You can if you have a time. If sometimes the examiner ask you, but this is operation just to explain to him if under general anesthesia or spinal anesthesia, and we have a camera and look into the ligament and try to trim it or repair it or whatever you are do. This is just diagnostic and sometimes therapeutic.
And ask about what's I have. I don't know what's I have in
No, you
my knee.
have one of the ligament tear. It is
Yes.
written, I just see in the script because usually the question he asked in the script. I just looking for it again. Took a painkiller, arthroscopy is called. Okay. Ligament. They have right cruciate is written here, right cruciate
Yeah.
ligament.
Yeah. Yes. Who asked me? Who asked the
No,
patient?
usually it is important that all the answer of the question in the scenario. So it is important if the patient asks you something like that, the scenario in front of you on the table, so looking for it. So it is right cruciate ligament. You can just make a diagram. We have two ligament cruciate, like anterior cruciate, posterior cruciate, all these. Okay. So usually he ask you something, it is written in front of you.
وقال له يمكن انت انا عايزك تديني ميعاد ضروري والميعاد ده يكون خلاص اخر ميعاد عايز اعمل فيه العملية.
Yes, هتقول له yes, I agree. The secretary contact you as soon as possible and sorry for that.
مهم. وقال له ممكن حضرتك انت اللي تعمل لي العملية ودي كانت مستر مان مهناش فاعمل لي انت العملية وخلاص يعني.
لا هو طبعا هم هنا مديك وظيفة ان انت SHO or senior or houseman or CT. CT is core training. core training ده houseman ده طبيب امتياز.
وقال له يعني انا I'm sorry I'm not authorized to
اه
do like this operation and I need
yes
the Mr. Man just to do the operation. I'm sorry I don't
yes
I
okay.
can't do this operation. Yes.
لو احنا عايزينك ان انت تعمل عمليه هنديك بقى بدل كور تريننج او SHO هنقول لك SR is specialist registrar like you are specialty, but houseman or houseman is in rotation because you know that in England in surgery rotation is 2 years. These 2 years suppose you are orthopedic or plastic surgeon, but you need to have 6 months general surgery, 6 months accident and emergency, 6 months orthopedic, and 6 months any specialty you wish. So
Mhm.
usually suppose you are cardiothoracic or orthopedic and you are in general surgery, so you are not much interested in general surgery.
Mhm.
Okay, so you are just make a clerking the patient, assist in the operation because it is not your interest.
Yes.
Okay, but if you can do this operation, we give you the title like you are specialist registrar, you are SR specialist registrar, you are specialized in this item. Okay.
دكتور هو
but
تو في البيشنت في الستيشن دي لما يكون فيها البيشنت عمال بيزعق وبيعيط، يعني هل انا ممكن اني من ناحيه الكوميونيكيشن وبيكون في حضرتك تو دكتور بيقيم النولج ودكتور بيقيم الكوميونيكيشن، يعني في اللحظه دي لما هو بيكون بيزعق وبيعيط ممكن انا يعني اعمل طريقه التواصل مع المريض، يعني مش لازم اني نكون مطيع جدا للمريض ونقعد نسمع فيه هو يعني اوتورايز مي، يعني ممكن اني نوقفه في بعض اللحظات اوقفه واقول له لا مش كده، لا يعني ممكن اتعامل معاه يعني مش بطريقه انه هو يعني يعتبر يعني المسيطر علي من ناحيه انه هو بيكون متهجم، يعني ممكن
لا،
اني
هو
احنا
مش هيضربك، هو مش
لا
هيضربك
مش
الحقيقة.
ضرب، لا
بس
مش لا بحكي
هي الفكرة ان انت ازاي يعني الانجري patient how to your response. You can give him tissue, you can give him water, but he become more angry if you don't give him explanation. يعني انت دلوقتي لما انا سألتك، انت ما قلتليش ان الراجل ده عنده حاجة vascular injury، فممكن يكون حالة عظم عادية ممكن كانت تستنى. ما انت لازم دايما الدكتور او consultant who is not a peer, you must give him something like he have aortic aneurysm, he have something serious, so this is why I will ask you, he's not coming. Okay. All right. It will be easy. So the next also angry patient is consent for appendicitis. Patient refuse to do appendicitis. Anyone or acute appendicitis, anxious mother. Okay, Ahmed Fahmi. Okay, Dr. Ahmed, you can start. I show you what is written. So this is a 15 years old girl complain of pain in the lower abdomen, brought to hospital by friends, diagnosed as acute appendicitis. She waiting her mother to sign a consent. Her mother refused to sign. You are Richard SHO surgical department. So
Okay.
the mother refused to be signed. This is different than spleen. Spleen, if the sign not sign, we straightforward. But this is appendix. Okay, you can start.
Okay. Hello.
Hello.
I'm Dr. Richard, SHO
Yes.
for surgical department.
Yes.
I
Okay.
hear that you refused to sign a consent for your daughter
Yes.
operation. First, let me know why do you don't want to sign a consent?
Okay. Actually, you just ask here, what do you know about her daughter? So I have a call from my daughter friend that she is in hospital and she waiting for operation. Okay. So I just ask you, doctor, first. So what you did for my daughter? What you give to her first?
Okay, we performed an examination, abdominal examination. Then we gave her we took blood for some investigation and give her some fluid and analgesic and antibiotics to
You
prepare.
mean okay. Of course, when you speak, also give some medical details. So how to give fluid? So intravenous fluid. You mean that you put a cannula, you give her antibiotic, and she is fasting now for the operation. Okay.
Okay.
So you ask me why I refuse to sign the consent. This is your question.
Yes.
Yes, because I read in the internet, so can patient improve by antibiotic, no need for surgery.
It is not for all cases. Surgery is for your child is mandatory because if it is not performed, it may unfortunately lead to some problems like this.
Yes, okay. How it comes? This is a small organ can cause this.
In severe cases of inflammation, especially in a child,
No, can
they
you
have
just
not.
tell me the details? The details like, so this is appendix can be perforated. The content is come out in the lining of the abdomen. We call it peritoneum, cause peritonitis. In some cases, this peritonitis can be complicated. So how this peritonitis can cause this? What is the name of disease cause this?
Sepsis, septic shock.
Sepsis. So septic shock or endotoxemic shock. So what is shock?
Shock is acute circulatory failure with incomplete tissue perfusion,
Inadequate tissue perfusion. Inadequate tissue perfusion. So the blood pressure become low and the pulse become high, and in this condition also the patient have fever, so we called it intoxemic or septic shock. Okay. All right, doctor. So, okay, I can sign. Can you just tell me more about the operation?
Uh,
What is the appendix and what is the procedure done, all this?
okay. The appendix is a small organ found right here in the right side of your lower tummy.
Okay.
This organs, the operation is called appendectomy, that we will remove appendix surgically. The surgery typically is done laparoscopically by small keyhole incisions,
How
or in some
many
cases,
holes?
three.
Three, at least three. Can be four, but at least three holes. Okay. So what's the size of each hole?
About 1 centimeter
1
or 2
centimeter,
centimeters.
half, some 1 centimeter. Okay. What else? So what else you need to tell me?
And after surgery, in some
If you
cases,
in the
we
script, if you don't tell the patient what she needs, she asks you. So I will ask you in behalf of the patient. So is all laparoscopic surgery, laparoscopic cholecystectomy can come straightforward, or some cases have difficulty?
okay. In some cases, we may have difficulties like sepsis or
No.
peritonitis.
Difficulty. So if have difficulty, what you will do?
We will make it an open surgery.
Okay, so when you consent the patient, so you need to say we start by laparoscopic surgery or keyhole, but in some cases, if you have some abnormal anatomy or a lot of adhesion, we prefer to become traditional or open surgery. But this is done, is my daughter is wake up during this whole procedure or sleep?
No, it will be sleep with general anesthesia.
Okay, so you need to mention first under general anesthesia, we do keyhole, 3 holes, about half to 1 centimeter, and in some cases we can come straightforward laparoscopic appendectomy, but some cases if we have some difficulty, we change it to become open. How long my daughter will stay in hospital after that? After
Typically,
laparoscopic?
laparoscopic may stay for a couple days
2
and
days,
can be
okay.
2 days.
Is have a stitch in the abdomen or no stitch?
If it is an open, there will be some
No, in laparoscopic. We speak about laparoscopics. They have some
stitches.
stitch. Okay, so when and where I will remove this stitch?
After 10 days at GB clinic nearby.
Okay, so if this is any complication can occur in the wound.
Yes, wound may cause some inflammation or hemorrhage or some. If you noticed increasing temperature or signs of inflammation, like tender or swollen,
what shall I do?
you have to visit to come back to hospital or visit nearby GB clinic.
No, just to come back to the hospital. GP is not interested much in surgery, so can come back to the hospital. Okay, so even if it is done in weekend or evening, shall I come?
Yes.
So in out hours you come to emergency. Okay. All right. So Dr. Ahmed, I ask you much, but I tell you what is supposed, because in exam, if you give the chance to examiner or the patient to ask you a lot, usually you maybe not understand him or maybe waste the time. So I just started from the beginning. So the beginning, you can start, ask the patient what you know about your case or your daughter. I know nothing. I just receive a phone call from her friends or schoolmate that she is in hospital waiting for operation called appendectomy, removal of appendix. Okay, so you tell her your daughter came to us with pain in the lower part of the abdomen. After blood investigation and clinical examination, we diagnose as acute appendicitis. So why you refuse that? Or what we give here, we put a cannula, we give intravenous fluid, we start antibiotic, and she is fasting, waiting for surgery. Okay, so why you refuse the operation? Because I heard or I know from Google or from the internet, we can take antibiotic. You know, nowadays we have a policy in some country that is antibiotic is better than appendectomy. This is even in medical, in some surgeon have this belief. So can tell me more what is the complication if not operated? So just tell her not all case improved by antibiotic. Of course, the appendix is a small organ in the right side of the abdomen, but in some cases can be have perforation and can affect the lining of the abdomen called proton cause inflammation of this organ, and this is inflammation can be worse cause something called septic shock, and septic shock can cause this, and this is characterized by low blood pressure, high pulse rate, and fever. What we will do after the patient agree, so under general anesthesia, we will do laparoscopic appendectomy. So we have keyhole surgery, about 3 small holes from half to 1 centimeter. We try to remove it by laparoscope. In some cases, maybe some difficulty. So we will do open traditional surgery. The patient stay in our hospital for 2 days. And after that, you can remove the stitch after 10 days in nearby GP. And if any complication like wound infection or fever, don't hesitate to come in the hospital, even in the out of working hour, you come to emergency department. Okay, Dr. Osama, what you need to, by the way, Dr. Ahmed, the mistake you make it is professional. You say he can die, but if you say the patient you die, and we don't tell him explanation, you are wrong. So
Okay.
it is like acute appendicitis or acute cholecystectomy. Patient can have ascending cholangitis, can die from sepsis, can. But don't say if we don't operate it, she will die. It is professionally not good.
Okay.
Okay. Dr. Osama, what you need to ask?
دكتور انا عايز اقول بس هي في كل لجنه يعني انك انت داخل الستيشن اذا
Yes.
كانت هي مثلا ستيشن بتاع السبلينيك تروما الانجري
Yes.
مادر وكذلك ستيشن هذه يعني اللي بيكون فيها بيشنت حتى هو جاي يعني مستعجل وملهوف على ابنه
اه
فاول ما
بيفضل واقف.
بيدخلوا هو اول ما يدخل وير از ماي دوتر وير از ماي تشايلد هو
Yes.
المفروض احنا كبدايه نقول بليز كان يو ار يو مادر اوف ذا توم هي
لا
حتقول
لا
لك
لا،
yes.
ما تفضلش تقول لها، يعني ما تبقاش الست يعني is in angry situation and some candidate ask can I show your ID, can you confirm that you are his mother. ما
No,
في
just ask
no no
to confirm.
the first you need to tell her first your son is in theater, so we don't allow to go, even me or you, so we can have a time to chat about the condition. But don't tell her what you know about your case, what you know about your son. Can I confirm that you are his mother? All this, because if you start like this, he become more angry.
يعني حدخل طول في الموضوع لما بتقولي وير از ماي تشايلد ولا كذا حول لا يور تشايلد انه هو في حجره الجهزي
So
في اجراء عمليه
first,
جراحيه.
your child is already in the theater. We don't able to go to there. So can you sit down? If you tell that, they sit down. After sit down, what you know about the case? Are you his? يعني you can start in formal way, but after she calm. اوكي، يعني انت تهديها الاول وبعد كده تقول لها انت بقى تعرفي ايه، لكن ما تبديش البدايه التقليديه. what you know about the patient, he don't know because she is have splenic trauma and they call her your baby or your son in theater.
يعني هي اول ما تدخل يعني انجري وتقول وير از ماي دوتر وير از ماي دوتر اوكي I will inform you your daughter now is taken urgently to the theater. هي حتقول لي why you go to the theater, what you will do in the operation.
No, in appendix is different because appendix you need a consent. So we prepare her for theater. Okay, in this situation, you can ask her after we discuss. We can go to see her. But in the splenectomy is different because the patient already in the theater. Okay, so it is just you need to modify it according to the situation. And usually the patient not sit down, the regulation, the patient not sit down except after you tell her, even we go to the theater, not allowed to enter, he's already in the
هي
theater,
ستيشن
he's in
بتاعتي كان
operation.
كده في الانجليسبلين، يعني اول ما
اه
دخلت واقفه، عماله واقفه
هي
بتعيط.
تفضل واقفة. he has not sit down except you tell her it is impossible to see him, it is impossible to go to the theater, so we can sit down and we'll discuss the case and what shall we
Yeah.
do.
انا دخلت قعدت على الكرسي وهي واقفه ومش عايزه اقعد، فقلت لها يعني your child in the theater in the operation please you can sit to inform you. فبتعيط في التياتر، هو في ايه، فحصل له ايه، ففضلت تبكي، فخليتها تعيط وديتها تشو يعني.
ايوه
دخلت
بس
تشو.
انت وصلتها للمرحله دي عشان انت ما قلتلهاش ان هو في اوضه العمليات مش هنعرف
لا
نروح
قلت
له.
لها، لا قلت
ما
لها
انت
قلت لها
يعني
انه في
دي كانت
العمليات
اول
بس
حاجه
بتعيط اكثر.
تقولها، وما تقعدش غير لما هي تقعد، ولو وقفت في
بالضبط.
النص وقف.
نوقف معها لما توقف هي يعني المفروض.
يعني انتوا لازم تبقوا ان ذا سيم ليفل، دي حاجه من الاداب بتاعت التوكينج يعني. alright ماشي دكتور حمزه. the next scenario the same also. It is patient. What is the patient refuse consent for OGD endoscope, just endoscope. Okay, I will share with you.
هي افضل ستيشن في ستيشن الاو جي دي، يعني تحس ان البيشنت كالم
All right. This is 55 years old man, chronic smoker, complaint from frequent attack of heartburn. You are surgeon in charge to take a consent from him for OGD. OGD, esophagus, gastric, duodenal, plus and minus. So can be or without biopsy. You are Dr. Richard, SHO surgery. Okay, you can start if you are ready.
Hello, I am Dr. Richard, SHO.
Yes.
I am here to explain more details about the procedure, what we are going to have. But first, can you tell me what you know about it?
I don't know what is this.
Okay, let me explain what about this procedure.
Yes.
This is what we call esophagio-gastro
OGD,
duodenoscopy, which
yes.
abbreviated by OGD. It's like introducing
camera.
Introducing of camera, which introduce from your mouth and passing it to your food pipe and then your stomach and then to the first part of your small intestine.
What is food pipe, doctor? What is food pipe called?
Food pipe, it's esophagus.
Esophagus. If you have your child or your young son is study science in Egypt or any country, he know esophagus or not? In the book of science for primary school, if your young brother
esophagus,
in primary
yes.
school and he study science in English, so he called it esophagus or food pipe.
Esophagus.
Okay, so don't be so. This is we are not speak to the layman. Even layman know esophagus. Okay, all right. So it is enter from the stomach, esophagus, from the mouth, esophagus, stomach, and duodenum, and you have a camera.
And you have a camera and they're taking some picture.
No, you have a camera and looking in the camera. You see, or the other see on the screen.
Okay, camera brings what inside your tummy on a TV monitor, which allow us to see the abnormality inside, and also taking some samples.
No, doctor, relax, doctor. Don't be just step by step. If you talk a lot, you miss a lot of number. So can you tell me about the procedure?
Sorry?
Can you tell me about the procedure? What is this? How to do endoscope?
Okay. We introduce the endoscope from
Doctor, when you ask about procedure in surgery in general, like if you describe an operation, you describe position, all this. What is my position?
Okay. Your positions is the left lateral positions, and you have to take anesthesia. This procedure is done under sedation.
How to take sedation?
By inserting an unbending agent at your back.
How to insert it? How to insert it?
By inject it at your back.
How to inject it? By cannula. So we insert the cannula and connect it to intravenous fluid and give sedation. Okay.
Okay.
All right. What is the name of sedation, doctor?
The name of sedation.
Okay, leave it till the end. Leave it till the end. After that, what else you will do?
And also we keep you on oxygen and also monitor all
okay,
all vital.
So how to give me oxygen and how to monitor oxygen?
Give you oxygen by keeping mask oxygen.
No, it is difficult to put a mask because you need to put a tube. So how to give oxygen? No. You know what something called the nasal prone. Nasal prone. It is something like small tube in the front of the nose.
Okay.
And how to monitor it? How to monitor the oxygen saturation by
pulse oximeter.
All right. What else? Next step. Okay. So you put a cannula. You give me
and insert numbing agent, anesthesia.
What is the name of lumping agent? What you mean by lumping agent? What you mean that? What you mean?
Anesthesia drugs.
No. Like you mentioned this. Okay, I am in the left position. You put oxygen, pulse oximeter. You spray something in my mouth.
Okay.
What you spray? Lignocaine spray in your mouth. You put a mouth protected and ask you introduce the endoscope. Okay. So I repeat this again. So position, you will be in left lateral. You insert intravenous cannula, intravenous fluid, give sedation. You put oxygen nasal prone, monitoring by pulse oximeter. You have mouth protected or mouth guard and local anesthesia, xylocaine spray for the mouth. You introduce the endoscope, ask me to swallow, and you will be asked to swallow. Okay. After that, it is painful procedure.
No, because you take anesthesia and
it is not anesthesia, doctor. It is not anesthesia. It is sedation. Anesthesia mean endotracheal tube. Sedation. Okay. Can you tell me what is the name of sedation?
Lidocaine.
No. Lignocaine is a spray, but sedation give it intravenous is midazolam. You see the screen now. Midazolam. 5 milligram per milli solution intramuscular or intravenous infusion, given 20 to 60 before the procedure. You know, midazolam is one of the Valium group. انت عايز تديله ايه؟
تمام. في اللي يعطوا في البروبافول يمكن او يعطوا في الدورميتوم.
Okay, can. But the common is midazolam because in the Valium, and the reverser of it because the midazolam can work about 4-6 hours is called flumazenil. Is the reverse. It is selective, competitive against the gamma aminobutyric acid is not important. So why we speak about sedation? Because if the patient say, I came by my car, so what is your answer?
It's not. It's advisable to have someone to to arrive to you after the operations.
Okay, so you need one to escort you back to your home. Okay, sometimes in some hospitals they ask one of social service to do that. So this is why we give a reverse, but we insisted to the patient don't drive back to his home. Okay, so what is the possible finding in my case? نبتدي بقى في medical knowledge. This is chronic smoker 55. What is the possible finding?
The patient by doing barium meal.
No. We don't barium. We don't do barium. It is have no barium done. The patient have gastric, have like what is called. Just a minute. Have gastric problem or gastric ulcer. So what it could be?
Okay, maybe the patient has strictures or changes in the mucosa or masses.
Okay, if have changes in mucosa, can have change in mucosa, can have masses. What is change in mucosa called? Lower part of esophagus, change of mucosa. What we called it?
It's Barrett esophagus, which means increase risk of adenocarcinoma.
Okay, just one by one. It is Barrett esophagus. What is Barrett esophagus? What is Barrett esophagus?
Barrett esophagus is metaplasia, which means a change of exchange of non-keratinized stratified squamous epithelium to simple columnar epithelium with goblet cells.
Okay, what is the danger of this Barrett esophagus?
The danger, it increases the risk of adenocarcinoma of
okay. So what you will do if you find Barrett esophagus or ulcer? What you will do?
Firstly, we take biopsy to find the stage of disease until now and can manage the patient so on.
What does biopsy mean?
Biopsy is taking samples from the tissue and analysis it to finalize the stage of cancer.
What is autopsy?
I don't know. Autopsy, no.
Autopsy is take a sample from dead. So biopsy is?
Take a sample from live tissue.
Okay, so biopsy is take a sample from living tissue or part of tissue to examine under microscope, what we call it histopathology. Your way of talking, doctor, is risk, because what we called it, when I ask you what you take, I take biopsy, just to say I take biopsy. Okay, so don't speak a lot. So because the next question, what is biopsy, what is histopathology, all this. Okay. So is any complication of this procedure?
Is there no procedures without complication? The complication may be include injury to your teeth while introducing the endoscope, and also maybe infection, also bleeding from the sample sites we taken, and also maybe the most serious one, which tearing of your esophagus.
Okay, so when I will know the result?
It may take 2 weeks, and I see your concern.
1 week is okay. 1 week. Okay. So I come to outpatient to know the result. All right. Okay. So, Doctor, who is the speaker? Is Dr. Hamza or Dr. Ahmed? Hamza. What's Dr. Hamza? When you speak, you need to, an exam usually have about 20 questions in 10 minutes or 9 minutes, 15 to 20. So your answer is like that. So what you will do, we're looking for the endoscope, we're looking for the esophagus, stomach, and duodenal, and if you have an ulcer, we take biopsy. That's it. So what is biopsy? Is taking a sample to examine under a microscope. Okay, what is supposed to be something like a mass or injury or ulcer in mucosa. What is ulcer? Ulcer is loss of continuity of lining epithelium. what it could be. Nowadays, the common is Barrett esophagus. That's it. What is Barrett esophagus is metaplasia. What is metaplasia? Is change from one type to type, from stratified squamous to stratified columnar with goblet cell. It is dangerous, yes. It is precancerous condition. All right. What is the risk of the endoscope? They can have damage of the teeth. You can have perforation, which is rare. Infection is very rare also. And we can have bleeding from the site of biopsy. All right. When I ask you extra question, like I ask you autopsy, so you just recognize that biopsy is taking sample from living. Okay. So at the end, thanks. And you don't tell me when I know the result, so I ask you. So it is important to expect it. What is the next question? You take a biopsy, the result, you can come to outpatient clinic after 1 week to know the result. All right, clear? Dr. Osama, what you need to ask?
Ask about the patient. He asked when I can able to take the food and how many كانت يعني بيسأل هو بعد كم ساعة ممكن إني أرجع للأكل الطبيعي بتاعي.
هو هنا مش حكاية البيوبسي. هو طبعا he can start, but you know that this patient is drowsy because he takes sedation. He can aspirate, he can stand. So after complete recovery, maybe after 4 hours due to the effect of sedation, so you can start by drink. After that, you can eat. But avoid spicy food and very hot food. Yes, at the end, so you know that we make an endoscope for you, and we can see what happened in your abdomen or your stomach or your esophagus, and if you have any query lesion, we will take biopsy and give you the result after 7 days.
اوكي. يعني دكتور تو احنا لما بنشرح له على البروسيجر حنفهمه على كل حاجه، يعني شنو هو الاو جي دي وشنو التكنيك اللي حيتم ليه، يعني طريقه الوضعيه على التيبل.
Yes, because in any prescription of any operations, you need to describe that your position, you have a cannula. Of course, if you say intravenous fluid is okay, but you know that we put a cannula to give your fluid, you give you sedation, we put nasal mask or nasal, not nasal prone, just nasal tube for oxygen. We follow up by pulse oximeter. We have a mouse protect your teeth, mouthpiece. Actually, it is to protect the endoscope, and we have xylocaine spray locally, and just to be not painful. But you are still drowsy, but not completely. It is not general anesthesia, but you are drowsy. Okay, Dr. Hamza, any comment from your side? انت استغربت الستيشن دي ولا حاجه ولا ايه اللي حصل؟
انا بس البدايه بتاعتها يا دكتور، انما بقيتها يعني البدايه بتاعتها ما قريتهاش قبل كده، انما بقيتها دي موجوده في السورس اللي انا بذاكر منه. يعني حته الانستيزيا والدسكشن اللي كان في اول 2 سلايدز يعني كان جديد بالنسبه لي.
Okay, so it is important to give, so all patients must have a cannula, must to give oxygen, all this. All right. I think we have this station which is Osama asked about it, confusion, post-operative, not confusion. Okay. So confusion or dementia or whatever, I just share. Again, no, it is not history. It is information giving. Okay. I think the other put in history, but it's not in the history. It's not history taking.
Yes.
Okay. So I just tell you because we have many people have a lot of debate in the exam. The station, if you examine the chest or what's called cardiovascular assessment or respiratory assessment, is not clinical station. It is physiology station. Okay. Because this is run by surgical physiology. We don't have in the clinical, we have 4 station or 3 station for clinical, 4 item. Head and neck, including cranial nerve and cerebellum, and of course thyroid, submandibular parotid. We have abdomen, which is easy, can be include hernia. We have vascular, can be ischemia, can be varicose vein, can be AV fistula. We have orthopedic, can be hip, knee, spine, and ankle. So examination or chest and cardiovascular is under physiology. Evaluation of the what we called it confusion patient is not history taken, it is information given. You take a history, you speak to the patient, but also you ask him. We can take Osama, for example, 75 years old woman admit to the hospital for redo elective total hip replacement, and she had an operation done 15 years ago. You are CT core training like houseman. Doctor asked by senior staff to consent the patient. You are Dr. Gandhi, SHO, and you found her confused. From this script or from this sentence, is this operation is urgent?
No, it's not urgent.
Okay, if I modify the exam and make it fracture neck femur or acute fracture neck femur since the 2-3 hours, so you must do the operation. Okay, so we choose an operation which is elective operation. The patient already did total hip replacement before. Okay, our aim, or we looking in this patient is preoperative confusion, so it's difficult to take a consent. You need to test the capacity for the consent. You need test for her confusion. The easy way, just orientation to person, time, and place. Okay. So you can start, دكتور أسامة.
هو تو يا دكتور، هو في حالتين، هو حيطلب مني هعمل ايه الام ام اس اور ابريفنتد منتال ستيت، صح؟
هو ما طلبش منك حاجة يا دكتور أسامة. We don't ask you anything. We just like this. So whatever you need to do, you can do.
لأن في الامتحان هو كان جايب إنه هو تعمل ام ام اس أو إنك أنت تعمل الابريفنتد. أوكي، أنا هعمل أي واحدة منهم يا دكتور. Okay.
Up to you. We don't mention anything. What you need to do, can do. You can start.
Okay. Hello. My name is Dr. Osama. I'm a SHO doctor.
Yes. Hello, doctor.
Please, can you tell me your name, please? And
my name is Anne-Marie.
Nice to meet you, Anne-Marie. Anne-Marie, today I need to ask you some questions.
Okay,
to test
you can
your
ask.
Memory.
Okay.
Yes. Please, can you tell me what's the? Okay, wait. Okay, can you tell me what's the name of this place, please?
It is hospital.
Okay, nice. Can you tell me what's the name of what's the floor of this hospital?
I don't know.
Oh, okay, don't worry. What's the season of this now?
It is rain, so it is like winter.
Okay. What's the month?
I don't remember.
Okay, don't worry. What's the date today?
I don't know also.
Okay.
I don't know.
Okay, don't worry. What's the name of the day today?
Monday.
Okay, that's great. Okay. Can you tell me what's the name of this country?
England.
Nice. What's the name of the city?
London.
Okay, that's great. Now I need to tell you some 3 things, and after that come back to mention me again. Okay.
Okay.
Apple, car, and watch.
Okay.
You can repeat it.
Apple, cat, and watch.
Okay. Now I need to ask you some question. After that, come back to you and to mention 3 things. Okay.
Okay.
Can you spell backward is the world, like WORLD? Can you speak backward?
No, I don't understand.
Okay, don't worry. Now I need to ask you about the three things asked you before. Please, can you mention it?
Yeah, it is Apple Cat Watch.
Okay, nice. Okay, that's great. Now I need you to take the paper by your right hand, and can separate the paper and put the paper by your left hand here. Can you do it, please?
What you mean? You give her a paper and need to swap or what?
Yeah, take the paper and ايش بقولها يعني اعملها على اثنين يعني نلفها على اثنين.
Okay, no problem. Okay, I can do it.
And put it by the left hand. Okay, that's nice.
Okay, all right.
Okay. Can you write me the sentences, please?
What sentence?
Any sentence you know.
Okay, good morning.
Okay, nice. Okay. I need to take the paper and this pen, and can you draw this shape, please? The circle shape like this.
All right.
Okay, that's good. Nice. Now I need ask you. Can you repeat with me? No fits or spits?
No fits or spits. Okay.
Nice. I need ask you last questions. Can you tell me what's this? Like
what
watch.
Is it? Okay, watch.
And this is the pen.
Okay, pen.
And this is the door.
All right.
Okay, nice. Okay, thank you. Now I need ask you another questions, please, if you're able to answer me. Can you tell me you have any past medical history, please?
Yes, I have this operation done 15 years ago. It's total hip replacement.
Okay. You don't have any chronic disease like hypertension, high blood sugar?
I have high blood sugar, but no hypertension.
Can you take any drugs?
I take aspirin to avoid stroke and to avoid deep venous thrombosis.
Okay, nice. Do you have any history of allergic from any food or any drugs?
I am allergic to seafood.
Okay. Can you tell me what do you do for a living?
I am retired. I am teacher before.
Okay. Can you tell me, are you smoke or
I smoke 5 cigarettes per day for the last 50 years, and I drink alcohol in the weekend.
You are able to do some exercise?
Yes, just walking sometimes.
Okay, that's nice, great. Okay. Okay, that's I'm finished. I need to ask you another questions. Do you have any another problem, like you have any disturbance in your water work or any disturbance in your...
Okay, so you need to ask about other systems. So, Dr. Osama, so apart from what you ask about family history, social history, and history of allergy. So you, as the end or before that, you need to ask about other system. Started from shorting of breath. You can start.
Do you have any shortness of your breath or any
no
difficulty you take a breath?
No.
Do you have any problem before, like your in heart, your problem or anything?
No.
You have any problem in your tummy and your abdomen?
No diarrhea, no constipation.
Okay. Okay. Do you have any no bleeding or anything in your
no
body?
bleeding.
Any
No
eczema
bleeding.
or any
No
rash?
bleeding.
Okay.
No bleeding.
Okay. Thank you.
So, Dr. Osama, of course, whatever you didn't start, but the important, because many of the students concentrate of the confusion and they don't ask about. So it is important to ask. I show you again, past medical history, including hypertension, diabetes. But I will tell you, I have diabetes. You don't ask me about medication. Okay. So it is important to ask about medication. Like if I take insulin, maybe hypoglycemic, maybe not control. You ask about past admission to hospital for 15 years, the family history, allergy, and social history. Okay. You ask about other system. You need to ask about loss of weight, loss of appetite. You miss it. We don't ask you to do many mental state or all this, but we just If you start from the beginning, Dr. Osama, you ask about name. You don't ask about how old are you. So you need to ask about age. What time you ask, how to remember the address or anything you ask, what is the year, what is the name of place, this is doctor, this is nurse, what my jobs, you ask about this. You can ask anything also, no problem. I don't know why you ask here to fold the paper. What is the value of that?
والله يا دكتور انا شفتها يعني في التست الام ام اس دخلت على جروبات يعني في اوكي والواحد يعني كيف الدكتور انه يحدد الكونسنتريشن بتاع البيشنت يعني الاوردر يعني انت تقدر تاخذ الورقه دي وتطبقها على 2 وتحطها بيدك اليسار تاخذها باليمين تطبقها على 2 وتحطها بيدك اليسار كانت في بعض البيشنت انه ياخذ الورقه ويطبقها يعني على 2 يحطها على 2 ويرجع يحطها ثاني بيده اليمين.
اوكي يعني هو بص
يعني
if you take it in simple way we just ask orientation to time, person and place. So time like we are in morning, what is this place, person like who is that,
هم 30 سؤال هم نحن مجبرين انه نساله الاسئله كلها او حتى جزء منها يعني.
هو احنا ما سالناكش اصلا to do this many mental state دكتور. If they have some station can, but in this station we don't ask you to do that. It is just orientation to time, person and the place. So just to take it easy. It is not important to us. After that, we have a discussion. We can start the discussion. After that, we speak to you. So what is your differential? This patient is confused. What is your differential diagnosis of confusion in old lady?
Yes, the confusion maybe, first of all, maybe patient have any, patient is diabetic, could be patient hypoglycemic.
Okay, so first hypoglycemic or metabolic disorder like hypoglycemia or hypothyroidism. What else?
Another thing could be patient have any transient ischemic attack. Maybe patient have CVA or any brain problem.
No, relax one by one. He can be high TIA, transient ischemic attack, or stroke, you mean? Or what is else is common? Okay, if what is the common bleeding you have in the skull in old people?
Subarachnoid hemorrhage.
No, subdural. Subdural because after you become older, the brain is shrinking, so they have subdural hematoma is easy. So the first you can see the screen, first trauma, especially subdural.
Maybe trauma, yes, subdural.
Second, infection. Because if the patient have UTI or any infection or chest infection or any source of infection, can be metabolic, can be hypoxic, can be hyperthermia, hyponatremia, can be vitamin deficiency, can be medication, some sort of medication or sedation. Okay, so it is important to looking for diabetes, looking for trauma because it's important to us. So how to manage this case? Before that, what your decision about surgery? What is your decision?
Patient is confused patient and is unable to take the consent from the patient, and we will postpone to the operation for my consultant and the anesthesia doctor.
Okay, because it is elective, not emergency operation. So what else you need to do? How to manage this patient?
First of all, I will start to take some investigation from the patient. I need to take CBC and take urea and electrolyte, CRB, and take urea, electrolyte, blood sugar, and another investigation imaging. Maybe I need to do a CT to the brain to show any site of the ischemia or hemorrhage, and maybe need to do carotid Doppler. Maybe patient have transient ischemia attack, transient TIA, and I need yes. This is the investigation and management underlying the cause, and do chest X-ray maybe patient has, and research from any source of the infection of the patient.
Okay, so Dr. Osama, also we don't give us what we need to tell you. This is all this apart from head trauma. The other is medical cause. Apart from head trauma, you can exclude it by CT. You can do CT skull, no problem. But who will treat this patient? Can you see the screen? Can you see the screen?
Yeah. Yes, I will consider asking about medical registrar.
Okay, so it is important. Usually in exam, the aim of this exam, you travel to England. So we don't supposed to treat cardiac patient. You don't supposed to treat complicated medical problem, because this patient have something hidden. Can be hypoglycemic, can be diabetic ketoacidosis, can be hypoxia, can be cerebral stroke, or can be head trauma. If it is head trauma excluded by CT like subdural, you can manage as neurosurgery or as a surgeon. But the other is all are medical. So what you tell in this station, first, I postpone the operation. It is not emergency operation. The patient have no problem, and we evaluate the patient first after that, because she have no capacity to sign the consent. After baseline investigation, you mention after CT of the skull to exclude head injury or subdural hemorrhage, I will be consult the medical registrar, looking for, or medical doctor or internal medicine doctor, looking for hypoglycemia, looking for diabetic ketoacidosis, looking for hypoxia, looking for any chest infection, looking for any disease can cause this patient confused. Okay, so you need to have a time. Yes, you need to have a time to tell that. You need to have a time for investigation. Okay. In this station, usually we have one station asking for many mental stated, but here we don't ask you about that. So just ask the patient simple question, orientation to time, person and the place.
هو في UK في السنة اللي فاتت كان في واحد صاحبي دخل الامتحان وكان في إن هي بيشنت مجهزة للعملية وطلبوا منه بليز يو كان دو MMS. ومن حوالي سنتين
if it is asked to do that, so you can do. But if not asked, don't be volunteer. And
yes,
just in simple way, like any simple way, like who is the president, orientation to time, person and the place, something like that. Just easy, like local event, like counting, something like that. Not much detail, not a paper, yeah, it is. It's more complicated. I think even psychiatrists don't do that.
Yes.
Okay.
يعني حنسأل الأسئلة اللي هي ممكن أنا من خلالها يعني أوصل لتشخيص البيشنت إنه هو confusion يعني.
هو البيزك in surgery just orientation to time, person and the place. So where we are in hospital, you have a nurse. What is this? It is a nurse. Who is I am? You are a doctor. You can ask, for example, who is the president now? Okay. We are in winter or summer. If it is easy, some simple question. Okay, just you can give her address and ask about the address.
هو اللي بيحصل يا دكتور إن للأمانة يعني أنا حتى الأصدقاء اللي دخلوا الامتحان قبل وعملوا امتحان يعني كلهم حتى جيتهم اللجنة دي وسألوا أسئلة يعني من ناحية اللي كانت MMS أو prevented mental state، ولكن لم يقوموا بأي سؤال ثاني الباس ميديكال هيستوري.
دول سيقطوا دول
والله في منهم اللي نجحوا يا دكتور.
ما ده ربنا كرمهم بقى. بص يا دكتور وسام. Okay. It is important to know history taken or information giving. We have an item. This is item you must be fulfilled. So don't ask a silly question and the end forget to ask the patient is diabetic or not, and this patient may be diabetic, take insulin, and she don't take food, and she's hypoglycemic, and she is in hypoglycemic coma or diabetic ketoacidosis or have a stroke, and you are interested to know, remember the watch and what is called, and the apple and the cat, and you ask her to fold the paper, and you ask her about the president. I see in one station, one of the students enter, we are in Malaysia, and ask the patient, who's the queen? What is the name? At this time, they still have a queen. What is the name of the Queen of England? So the patient tell him, how it come I know the Queen of England? I don't even know any country except my country. Okay.
يعني دكتور ما نتعمقش في الأسئلة كتير.
and I just tell you the next question. He asks you what is the Prime Minister in England, something like that. It is not important because sometimes maybe you don't know the some of minister in your country. Okay.
معنى يا
All
دكتور
right.
إن في أسئلة كثير مش لازم إن هي تتسأل يعني.
Of course no. Just take it simple, in simple way.
يا دكتور انت لما انت عملت معك ستيشن دي حتديني كام من 20 مثلا لو انا جيت لك في الامتحان يعني وسالت نفس الاسئله دي والدسكشن.
No, أديك if you manage the time, I think if you do like this, maybe the time is not come and I have no time to ask you about the management and the diagnosis. And this is the problem. So it is important. If you speak a lot, you need to, management of time is important. Usually we have 6 hours or 6 minutes or 3 minutes remaining. So I think if you ask all this question, you maybe take more than 6 minutes. So just take in simple way. All right.
Okay, doctor. Okay.
Okay. I just stop. بص